While I am a physician, the information presented in this podcast is for educational purposes only and should not be considered medical advice. It is not a substitute for professional medical advice, diagnosis, or treatment. Please consult with your own healthcare provider before making any significant changes to your lifestyle or routine. By listening to this podcast, you are not creating a physician-patient relationship. Welcome to the Purposeful MD podcast. As a physician, you've sacrificed so much of your life for other people, your patients, your family, your friends, and your colleagues. What would it feel like to spend time doing what you enjoy and to live without guilt? I'm your host, Dr. Laura Sutton, a family physician, certified coach, and business owner. If you're a medical professional on a journey towards your most purposeful life, a life with more time and energy, and ultimately more joy, then this is the podcast for you. Welcome to the Purposeful MD podcast. We've got Dr. Michael Foti with us today. Dr. Foti, welcome.
Thank you. Thank you so much for having me.
Yeah, it's good to talk to you. I'm excited to dive in. So Dr. Foti is an internist trained at Greenwich Hospital, Yale, New Haven Health. He's currently a clinical assistant professor of internal medicine at Toro College of Osteopathic Medicine and is also the coordinator of the Standardized Patient Program. He's a member of the National Faculty of the National Board of Osteopathic Medical Examiners in the Clinical Department of Internal Medicine, Geriatric Medicine, and Dermatology. Also a member of the Board of Directors for New York State Osteopathic Medical Society and vice president of the National Alliance on Mental Illness in Orange County, New York. And also the author of a book called Grief, A Doctor's Battle with Anxiety and Depression. And I know you'll share more about that. So welcome so much. Thank you so much for being here, Dr. Foti. It's great to
Thank
have
you.
you.
Thank you.
Yeah.
Thank you so much for having me.
So I've heard your story a little bit on a previous podcast with AMA, but I'd love to have our listeners hear your story again and how your story brought you to where you are right now.
Definitely. Yeah. So, when I was an intern in internal medicine, the second half of that being 2020, was when COVID-19 first arrived, in the United States. So obviously, that was a very chaotic time. We witnessed, all of us in the healthcare field, much suffering and death. And it wasn't just the frequency of that, but also the fact that so many of our patients were young. They were, in their 30s and 40s, and it was very devastating. And that coupled with the fact that around the same time, my mom passed away relatively suddenly to what we found out to be stage 4 lung cancer. She passed away within a few weeks of her diagnosis.
Mm.
And so it was a very difficult time. Fast forward a couple of years later, I graduated from residencies when I developed a very severe anxiety and depression. And it took many months for me to finally get the help that I needed and realize what was going on. And I did. I did eventually get that help, thankfully, and I'm in a much, much better place, thankfully. Um, but I very much know what it means to suffer in silence, and I did for months. And because of that, and thankfully being in a better place, I've definitely become a very strong advocate for mental health awareness, so that others don't suffer in silence like I did.
Yeah. Thanks so much for sharing. I'm so sorry for the loss of your mom.
Thank you.
Yeah.
Thank you.
I lost my dad to lung cancer too, and so
Yeah,
yeah,
I'm
it's
sorry.
terrible. Um And on the other side of that, I'm so glad to hear that you're doing well now and here talking with us and advocating for mental health. So tell us if as much as you can, just your experience. I want to hear more about your experience being an intern in the second half of your year being the spring of 2020, essentially.
Mm.
And then the level of support, or I'm picking up, assuming probably lack of support related to mental health and really your own mental well-being and that of your classmates. Tell us a little bit more about your experience with that.
Yeah, definitely. I mean, again, these were, it was all hands on deck. These were 12, 16-hour days. They pulled everyone from elective or outpatient rotations. Our outpatient center closed. We were all in the hospital. I was part of So we were divided into teams as residents, residency programs often do, and um, the team that I was on responded to RRTs, or for those who may not know, that's rapid response team. So that's basically responding to emergencies in the hospital. And so, pre-COVID, you're talking maybe once or twice a day where I trained at the very least. Um, During that first wave of COVID, we were in and out of patient rooms every hour, right? And this was usually because the patient's oxygen level was dropping very quickly, and we had to try to go up on that oxygen level with whatever we could. And eventually, again, this was happening all day, every day. It was getting to a point where we were making decisions on whether our patient needed to be intubated and put on a mechanical ventilator, calling family members to explain that to them that, their 30-year-old brother or sister, was basically dying and they needed to be put on a ventilator. And we were making those phone calls and we were making those decisions, right? And this was all day, every day for months. So that's what made it very difficult, for sure. And, in terms of resources, there's, there wasn't really so much. I mean, we had, um, like a telehealth type employee assistance program, but and this I speak for any and probably all programs across the country. That's probably the most of what they have in terms of providing mental health resources. It's not enough, right? But at the same time, the frequency with which we were working and the amount of hours probably wouldn't have been able to uh, really take advantage of any resources had they been there, whether they were sufficient or not. Um, so they did the best that they could. And again, this is nothing to do with Greenwich themselves. They're a great hospital and program, but that's more a systemic issue in the country that we need to work on. But yeah, we there was no time to think about any of this. This was very much uh, emotional trauma that I'm sure I'm not alone in now, that I suffered the consequences of years later, and I'm sure there's others out there as well. So, you know, I
Yeah.
think that's the basis of that.
Yeah. I mean, you're talking about mental health resources, excuse me, in that scenario. And I'm thinking too, physical health resources, right? I mean, if I put myself back in April of 2020, just for your awareness and for our listeners, I was seeing patients, but in an outpatient setting, and it wasn't a big part of my role, my clinical role. And so I'm picturing, we don't have enough PPE, right? We didn't know really what was needed to treat the virus and to treat these patients. I know we were putting them supine for a lot of that time to try to help with their lung capacity. And so there was so much unknown, lack of PPE, lack of really this network where we could share information with each other. I'm sure, like you, probably texting colleagues across the country. What are you doing? What are you seeing? What's worked? What's not worked? So lack of any sort of evidence to treat patients. And then you mentioned long hours. I mean, so I'm thinking even eating, sleeping, making sure that your physical health is taken care of, making sure that you didn't also get sick with COVID and become one of those patients. And so, if we think about the Maslow's hierarchy, until we address those physical needs, then the mental health isn't going to get taken care of. And yet, when we put our bodies physically under that much stress, we know that it affects mental health. And I want to get into that a little bit too. So, I'm curious your thoughts on that. It sounds like that was your lived experience.
Yeah, for sure. I mean, there was definitely that fear every day of going into work because you didn't want to bring it home. Uh, I got to tell you, during that first wave, we didn't know what it was, and I wasn't thinking about I might get this and die. Like I didn't, it wasn't crossing my mind. I didn't want to bring it home. I mean, that's for sure. But I was running in and out of rooms all day. I never took my N95 mask off, right? So, I mean, fear wasn't existent because you wouldn't be able to do your job if that really crept in.
Right.
So we were kind of just leaving that at the door, so to speak, and doing what we needed to do. It was very much like a war zone. I'm gonna be honest with you. This was PPE left and right, IV cars up and down the hallway, running in and out of rooms. It was chaotic to say the least. And as uh, I say this in my book, as organized as chaos could be. Um, it was, we did our best, and but it was tough.
Yeah. Are you still in touch with any of your classmates? I'm curious what some of their experiences were as well.
Yes, yes, actually. So I recently started a podcast with one of my very good friends, Dr. Gina Marie Papilla, or Dr. G as I like to call her, called the Upward Spiral Podcast. We're only into maybe 4 episodes in, and we were both interns together, and we've remained very good friends since. We did our very first rotation as interns together, night shift, and you know, um, yeah, our experiences were very different, and we talk about this. We actually talked about it during our first episode, where it was just me and her, and I was on the floors, as I mentioned, in the RT team, and she was in the ICU. So, it's something I never thought about, but she speaks often about how we had such different lived experiences because she was in the ICU, where by the time patients came to her, they were intubated and on a ventilator. And yes, they were talking to patients' families, of course. Whereas I'm on the floors talking to the patients and their fear in their eyes of how is this happening to me? I'm 30, 35 years old, and you're telling me that I have to go on a ventilator, so we talk about it often, how different our experiences were, and it just like, corridor to corridor in a hospital.
Yeah, that's yeah. I can only imagine. I'm glad that you have work are working with her now to kind of share those experiences. I love that. I love that visual of the upward spiral. And so we'll put a link to that in our show notes because we want listeners to check that out too.
Thank you.
So take me again kind of through your intern year. You mentioned developing anxiety and depression sometime later. And so was that a something that what's coming up for me is the book The Body Keeps the Score, about how our bodies internalize these experiences that we have, and they can sometimes manifest as anxiety and depression and other um, other health challenges. So that at least that's the visual that's coming up in my mind. So tell me your experience with first being diagnosed and what resources were available to you at the time and your story from there.
Yeah, so it really didn't manifest until after residency, which is pretty interesting. But I think it was because the challenge of being an attending and the fact that I internalized all of this trauma, that I just had no resilience to really overcome that challenge of that transition in my life, is what I now know. Obviously, I didn't know at the time. So it began really as, so my first position out of residency is I was actually a residency preceptor at another hospital in Connecticut. Very much interested in academics, as now we all know I'm teaching. But um, what happened was it was a nightly, basically very severe panic where I'd have a very intense pressure in my chest as if someone was trying to, literally rip open my rib cage, and a very severe squeezing sensation on my left arm, and really the most unbearable sensation I never wish on anyone. And this was every night. And every morning, waking up with a very intense fluttering in my chest, which I carried through me, the rest of the day. And this, again, 3, 4, 5 months pass. And I was just thinking that I was stressed from work, that it was just too much to transition on me to an attending life. And I didn't think of more than that, just stress, right? And eventually, I switched jobs thinking that it was the job. And so I went to general primary care, but it continued, to the point where I was not sleeping. I felt sick. I had colleagues covering my patients because I was leaving early, thinking I was sick. Eventually, though, and I remember it was December of 2022, and I had the worst panic attack up to that point, where honestly I thought, well, maybe this is my heart because it wasn't going away. I couldn't breathe. So my wife brought me to the emergency room, and they did all their testing, and obviously my heart was fine, and wound up seeing a psychiatrist in the emergency room. But a very long talk with me, and I really appreciate she was a she probably doesn't even know it, but a big turning point in my life. She sat with me for like about an hour or two at my bedside in the nursery room, and we just spoke. And she just asked me what's been going on recently. The best approach probably she could have ever taken, because if she didn't say that, I probably would have said, "Oh, I'm just stressed from work." And so I told her everything that happened, like I'm telling you and your listeners now. And she told me, like, why are you surprised? I mean, look at everything you've dealt with, right? You lost your mom, you lost ton of patients, and you're grieving, and you're now suffering from anxiety and depression, and that's when I was diagnosed. So I took a medical leave. Talked to the question you mentioned about the support I had at the time. I had no option but to take a medical leave. This is something, again, I'm not blaming the position, but something at the system level that we need to change, where we don't have enough mental health resources and outlets for physicians and really anyone in the health workforce. It's treated solely as a disability, and you got to take time off and come back when you're ready to go. And so unfortunately, I think that's something that needs to change, but that I could speak on after. But I think that I took a medical leave, and that was the best thing I could have done. I saw my primary care doctor. He started me on an antidepressant. I went to see a psychologist weekly, and it's the best thing I could have ever done. And I'm in a much better place for it.
Oh, I'm so glad. Those experiences sound just so frightening, what you felt, the chest pain and the yeah, it just sounds really frightening. And like I said, I'm glad that you got the help that you did.
Thank you.
Yeah. So what, because you touched on it, and I really want to spend some time on this too. What what are you seeing as, are we starting to make changes to the resources that we offer for our trainees and our any of our physicians? And what still needs to be done?
So I think awareness has changed and has increased, right? We have wonderful organizations like the Dr. Lorna Breen Heroes Foundation, for which I'm an ambassador. Which they led to the Provider Protection Act, that legislation that's passed. You have wonderful organizations like NAMI, raising awareness on mental health, and just physicians speaking up on this, right? I see this left and right. Wonderful colleagues that I can now call colleagues speaking up on this, but at the actual system level, in terms of providing these resources, they're very much lacking. It's very inconsistent, from hospital to hospital and medical school to medical school. And in my opinion, again, when we're not there, every medical institution, medical school, and healthcare institution should be campaigning on mental health and wellness for their health workforce and for their medical students. It should be right then and there everywhere, right? And there should be a dedicated behavioral health center for our health workforce and for our medical students, that they're only seeing there are medical students, they're only seeing our health workforce. And so these two steps, what it does is it says to someone in the health workforce, or it says to a medical student, it's okay to not be okay, right? Get that help. We're here for you, right? It empowers them to seek out that help and get the help that they need, so that they don't suffer in silence, right?
Mm.
Like I did. And so I think those are two big steps that, as a country, we need to take.
Yeah, I love that. It's so important. It's it's like reducing the stigma is kind of what I hear from you, and encouraging people to say, "Hey, I'm struggling and I need some help," and that we can, like you said, empower them and show them that it's okay, that we don't have to go through this alone. I mean that even not in a pandemic, the experience of residency is traumatic, and there's so much going on, so much just that we're trying to learn, first of all, and then we put our bodies through so much stress. And then to add in there a global pandemic like none of us have ever seen in our lifetime, I can't imagine why anybody wouldn't need any sort of resources related to mental health and stress. And I think, at least I feel like there's still, and I'm curious your perspective too, is there still kind of this suck it up mentality, like, well, it's just tough. We got to tough it out. And I get a badge of honor for sleeping the least on call. And are you still kind of seeing that there's this really tough exterior that we're up against that is getting in the way of improving the mental health of our workforce?
Of course. Yeah, and this has been perpetuated by the culture of medicine for years, and it
Yeah.
continues to be, right? So you're having, that message not only to our medical students, but to our residents to say, oh, well, you just got to dig in, right? This is a resilience thing. You just got to be more resilient, right? And what that takes is just digging in, right? That's the message, right? Yes, it's hard work, and I don't think we need to tell them that. I think they know that, but they should feel safe to get the help that they need for that very reason that you said. It's a very difficult time. Medical school residency, that's the toughest part of the journey, and they should feel empowered to get that help. But yeah, I think it's definitely a culture that unfortunately, continues to persist, and it's something that we have to change.
Yeah, you've mentioned the word resilience a couple times. I know that's kind of a charged word because at least I hear it almost in a negative sense in the when talking with other physicians in the sense of like, well, don't tell me I need to be more resilient because I'm already resilient enough. And you mentioned it that's something that and you said like I didn't have this resilience when I was in my training and I think I mean as clinicians we are already very resilient as physicians going through this. But the medical training system kind of sucks it out of us to some extent. And then it can make us feel, and when I went to school, I feel like my program was along the same lines as every other program, right? I'm not saying that my program did anything that was really kind of degrading our training or mental health or anything like that. That was it's just the culture. And like you said, it needs to change. But yet it can make the physicians feel like, well, there's something wrong with me. And especially if people aren't talking about it, because then, like you said, they're suffering in silence. And we feel like, well, I must be the only one that feels this way. And that must mean there's something wrong with me because everybody else around me can hack it. Why can't I? Why am I the one that's struggling? And so I love the messages that you're putting out there in this environment that you're creating to help the trainees and help the people in your institution really thrive and just even just talking about it. I'm really impressed by that.
Thank you. Yeah, I think it's just normalizing, right?
Mhm.
Getting help. Because uh, when you have, articles like one I saw recently that was titled, "Are we talking too much about mental health?" That tells you that there's still an issue, right? And I think that the previous generations of physicians, when they say the word resilient, what they mean to say is they survived. All I can say of those physicians is that they survived. They survived their surgical weekends that they like to call, right? Their 72-hour weekends and their 120-hour work weeks and all these different things they want to say, right? You survived. That's not resilience, okay? Resilience, in my opinion, is thriving. That's not thriving, right? You have to have a proper balance of grit, sure, but self-care and self-compassion. They go hand in hand because I think you know, we can go on, but I think there's data, right? The physician suicide is on the rise. Mental health is a hot button topic for a reason. All right. So we're not just making this up. We're trying to save people, right? Meaning our physicians and workforce so that they can save others, right? So, we're in a dire time, but we need to continue to speak up.
Yeah. Yeah, I love what you said about resilience, that it's just surviving is not resilience, it's thriving because we think about the number of physicians that are in mid to late career that would say, I wouldn't do this over again. And then who's going to take care of our family members? And then who's going to train the next round of physicians? And how are we going to maintain a healthy workforce unless we're all thriving?
Yeah,
Yeah.
100%.
What is it that you're doing in your program specifically to help the trainees and the physicians thrive?
Yeah, so we also, as I mentioned, I'm part of NAMI, which is the National Alliance on Mental Illness in Orange County, New York. NAMI wonderfully also allows for student organizations. So we now have NAMI on campus, and we're going to be doing wonderful events for our students on campus, such as I'm going to be leading a guided meditation for our students, which will be great. And most especially, so NAMI Orange County, New York is holding our first ever NAMI Walks, which is a fundraiser for NAMI to continue to provide mental health resources, basically at no cost to our community. And so that's September 1st. And yeah, so we're getting it approved as a student run event, as a student sponsored event rather as well, and just to continue to speak up and raise awareness and provide mental health resources.
Yeah, that's awesome. Thanks so much. NAMI is a great organization, and I know they do a ton of good all over the country. So, yeah, we'd love for our listeners to help support that effort, and we'll put that link for the
Thank
fundraiser
you.
in our show notes too. Yeah. Well, tell us about your book. Your book is called
Yeah,
Grief.
yeah,
It's
yeah. I
called,
have it here.
yeah, it's called Grief, A Doctor's Battle with Anxiety and Depression.
Yeah, so it's interesting. So I started writing down my experiences and the very kind of vivid details of what I mentioned, right? Really, the lived experiences on paper. Really, it was something therapeutic at first to help process that grief, right, as it's titled. And once I started, I've been doing so many speaking engagements, and I realized that my story can help other people, which really I'm so humbled by that I have a story to tell that's actually helping people. I figured, well, why not put this in print and try to reach more people and try to help more people, right? Because obviously, being an author is not a full-time gig for me. It's not something that, is keeping the lights on. I'm just trying to help others and reach as many people as I can with my story.
That's awesome. What's been the response to your book?
Great. Yeah, I mean, it's been wonderful. Colleagues, friends, family, everyone reaching out to me. They love it, and they said it's very powerful. And some people like coming up to me that I know that I'm sorry, I didn't even know you went through that, and a lot of that as well. But yeah, it's been very positive.
That's great. Yeah,
Mhm.
we'll put links to that as well and available on Amazon and then Barnes and Noble as an ebook.
Hmm.
Yeah.
Thank you.
Yeah. Yeah, I know writing is not for the faint of heart. I'm right there with you. So and especially
Yes.
when it's so
No.
personal. I mean, you have this lived experience and it's such a testament to your character that you are now, you're turning this into something that can help other people and you're sharing about it and allowing that to really help others and so other people don't feel so alone. And so that's taking, you're taking that pain and making something beautiful out of it, as beautiful as can be. So I really admire that.
Thank you. I really appreciate that.
Yeah. Well, it's so wonderful to have you, Dr. Foti. Is there anything else that you'd like to share with our listeners?
I mean, no, that's it. If you could, support our fundraiser, I think that'd be amazing. And I'd love if you read my book. I think it's, especially if you're going through any of what I went through similarly, or know someone who did or is, that'd be wonderful.
Yeah. And we will put your links for your LinkedIn profile and your Instagram as well in our show notes. Our listeners can stay connected with you. Thank you for your work, Dr. Foti. It's really inspiring and again, I'm just so glad that you're here with us and sharing your story and spreading your light with to others. Thank you.
Thank you. Really appreciate it.
Thank you for watching The Purposeful MD on YouTube. If you like what you see, please like and subscribe. Please also visit www.thepurposefulmd.com for free downloads or to discuss working with me as your coach.